Dear learners, welcome to this module of Non-Communicable Diseases Part 2. I am Professor Swati Rajput from Department of Geography, Shaheed Bhagat Singh College, University of Delhi, and author of the book Geography of Health by Concept Publications. In the previous module, we learned about concept of lifestyle diseases and their patterns in the world. The objectives of this module are that the learners would know some facts about non-communicable or lifestyle diseases in India. The learners would learn the key determinants of lifestyle diseases in India, and you would also understand the distribution of non-communicable diseases in India. The learners would get an insight in cardiovascular diseases, cancer, obesity, nutrition deficiency diseases, hypertension, thyroid, diabetes, PCOS in India. The chapter would also focuses on the ways for managing the non-communicable diseases. Lastly, learners would know some government schemes to mitigate and manage the rising concerns linked to communicable diseases in India. As discussed in previous module, non-communicable diseases are medical conditions or diseases that are not caused by infectious agents. These are chronic diseases of long duration and generally with slow progression and are the results of a combination of genetic, physiological, environmental and behavioral factors. In a report, India Health of the Nation states by Ministry of Health and Family Welfare, Government of India, it is found that there is an increase in the contribution of NCDs from 30% of the total disease burden, disability adjusted life years in 1990 to 55% in 2016. This increase in proportion to the deaths due to NCDs among all the deaths from 37% in 1990 to 61% in 2016. This shows a rapid epidemiological transition with a shift in disease burden from communicable disease to non-communicable diseases. In India, the burden of non-communicable diseases has surpassed communicable diseases, posing new challenges in 21st century, and this transition is clearly evident over the past few decades. Generations who had survived the early childhood diseases are now prone to lifestyle diseases. So let us begin by examining through some facts about non-communicable diseases in India. NCDs contribute to around 5.87 million, that is 60% of all the deaths in India. The major causes of NCD deaths in India are coronary heart disease, stroke and hypertension, chronic respiratory disease, cancer, diabetes, etc. India's burden of NCDs is escalating. NCD typically present in individual age 55 years or older in many developed countries, but their onset occur in India almost a decade earlier. Prevalence of cardiovascular diseases and their share of mortality are predictably higher in the high and higher middle ETL levels. It is the state of Andhra Pradesh, Goa, Himachal Pradesh, Kerala, Maharashtra, Punjab, Tamil Nadu and West Bengal. In India, the key determinants driving NCD risk factors have been linked to aging population, globalization, relentless urbanization, which has led to lifestyle changes, opening markets for food, alcohol and tobacco industries. Also, low levels of education, poverty, poor housing conditions and inadequate space for physical activity compounds for the burden threatening the sustainable growth and productivity of the nation. The most vulnerable group to the NCDs are constituted by the younger age groups and the poorer section of population. If we see the mortality in the case of non-communicable diseases, we find that cardiovascular disease contribute to 28.1% of the total deaths in India, followed by stroke, hypertension, chronic respiratory diseases, cancer respectively. Let us now focus on few selective diseases. Obesity. According to the fifth round of NFHS, that is National Family Health Survey, conducted between 2019 and 21, about 6.4% of women and 4% of men aged 15 to 49 in India are obese. Around 17.6% women and 18.9% men in the same age group are overweight but not obese. Studies showed that obesity also causes problems in thyroid function. Obesity also affects you psychologically by being bullied by society, which leads to a state of repression. Obesity among males have risen from 18.9% to 22.9%, and in females from 20.6% to 24% from 2015-16 to 2019-21. Obesity among children has drastically increased from 2.1% to 3.4% in 2019-21. Body mass index, one of the major measure for obesity. So it is an indicator of obesity, and it is high in both northern, that is the states of Haryana, Himachal Pradesh, Punjab and Uttarakhand, and southern states of Andhra Pradesh, Goa, Karnataka, Kerala, Tamil Nadu, ranging from 22.8 kg per meter square, kilogram per square meter among males in Uttarakhand to 25.1 kg per meter square among females in Punjab. Body mass index is less than 20 in Rajasthan, Madhya Pradesh, Bihar, Jharkhand, Orissa and Assam. This can be linked to the type of economic activity and food consumption in this region. Regions where food is available in abundance and accessible easily with BMI seems to be very high. Though there can be several other reasons too, like the type of occupation they are involved in. Malnutrition and deficiency diseases. According to Worldometer, India is the largest contributor of undernourished people in the world. This means roughly 194.4 million people, or 14.37% of its population, not receiving enough nutrition. Child malnutrition scenario is one of the worst in the world, with 1/3 of the malnourished children of the world being Indian. As per the Government of India National Family Health Survey round 5, 36% of children under age 5 years are stunted, 19% are wasted and 32% are underweight and 3% are overweight. Children born to illiterate mothers or children in the lowest wealth quintile are most likely to be undernourished. Geographically, Maharashtra followed by Bihar, Gujarat have the worst levels of malnourished children in India. Madhya Pradesh, Andhra Pradesh, Jharkhand have very high rates of undernourishment. Incidentally, these regions also have the highest population of children and the highest poverty rates. Even states with the lowest percentage of undernutrition such as Mizoram, Sikkim, Manipur have much higher malnutrition rates than the developed nations. Region-wise deficiency observed are that northern India, Bihar, UP, Rajasthan, iron deficiency anemia is prevalent in northern India, particularly among women and children. According to National Family Health Survey round 4, the prevalence of anemia among women aged 15 to 49 in Bihar is around 53%. Vitamin A deficiency is also a matter of concern in northern India. NFHS 4 data shows that Uttar Pradesh around 54.9% of children aged 6 to 59 months have a vitamin A deficiency. Limited access to nutrient-rich food, poor sanitation practices and inadequate healthcare facilities contribute to these deficiency diseases. In northern India, socio-economic factors, cultural practices and lack of awareness about proper nutrition can also play a role. Looking at eastern India, West Bengal, Odisha, Jharkhand, iodine deficiency is a major concern in eastern India. According to a study published in the Indian Journal of Public Health, the prevalence of goiter as a consequence of iodine deficiency in school-age children in West Bengal is as high as 32.6%. Vitamin D deficiency is also observed in this region. A study conducted in Odisha reported that 51.6% of adolescent girls had deficiency and insufficient levels of vitamin D. Protein energy malnutrition is also prevalent in Odisha and Jharkhand. This is mainly due to extreme poverty and hunger, limited availability and consumption of iodized salt, Lack of awareness about the importance of iodine and limited exposure to sunlight contribute to iodine deficiency and vitamin D deficiency in eastern India. Poverty, inadequate healthcare and infrastructure, and cultural factors may also contribute to these deficiencies. Coming to southern India, that is Kerala, Tamil Nadu and Karnataka, calcium deficiency is a prominent issue in southern India. According to a study published in Indian Journal of Clinical Biochemistry, the prevalence of calcium deficiency among pregnant women in Karnataka is approximately 50%. Vitamin B12 deficiency is also observed in southern India, particularly among vegetarians. A study published in Indian Journal of Community Medicine reported that in Tamil Nadu, around 16% of participants had vitamin B12 deficiencies. Dietary factors such as low intake of milk and dairy products contribute to calcium deficiency in southern India. Next comes the cardiovascular diseases, that is stroke and heart diseases. CVDs have now become the leading cause of mortality in India. A quarter of all mortality is attributable to CVD. Heart disease and stroke are predominant causes and are responsible for 80% of CVD deaths. The global burden of disease study estimates of age standardized CVD death rate of 272 per 1 lakh population in India is higher than the global average of 235 per 1 lakh population. Despite wide heterogeneity in the prevalence of cardiovascular diseases factors across different regions, CVD has emerged as a leading cause of death in all parts of India, including poorer states and rural areas. The progression of the epidemic is characterized by reversal of socio-economic gradients. Tobacco use and low fruit and vegetable intake have become more prevalent among those from lower socio-economic backgrounds. In addition, individuals from lower socio-economic backgrounds frequently do not receive optimal therapy, leading to poorer outcomes. In India 2016, CVDs contributed to 28.1% of the total deaths and 14% of total disability adjusted life years, compared with 15.2% and 6.9% respectively in 1990. Within India, the rates of CVD vary markedly from the highest in states of Kerala, Punjab, Tamil Nadu. The age standardized state level mean 10-year CVD risk varied from 10.2% among females in Assam to 24.2% among males in Nagaland and Himachal Pradesh. Similarly, the age standardized prevalence of a high CVD risk varied from 5% among the females in Assam to 30.4% among the males in Kerala. Among both males and females, CVD risk tended to be highest in South India, including Goa, the three most northern states, Himachal Pradesh, Punjab and Uttarakhand, the northeastern states except for Assam, and West Bengal, particularly among males. Next is cancer. Let's talk about cancer. Cancer cases in India have been rising significantly over the past few decades. In India, some prominent causes for cancer includes tobacco and alcohol consumption, unhealthy eating habits, use of chemicals in the form of cosmetics and toiletries. According to Ministry of Health and Family Welfare, tobacco consumption is either as chewing tobacco or smoking tobacco accounts for 50% of all cancers in men. Dietary practices, reproductive and sexual practices account for 20 to 30% of cancers. According to Indian Council of Medical Research, National Cancer Registry Program, the number of cancer cases in the country is projected to go up from 14.6 lakhs in 2022 to 15.7 lakhs in 2025. According to the data of National Non-communicable Disease Monitoring Survey, Uttar Pradesh recorded the highest number of 2.01 lakh cancer cases in 2020, followed by Maharashtra, Bihar and West Bengal. Himachal Pradesh, Uttarakhand and Jammu Kashmir, Haryana and North Eastern states are witnessing low levels of cancer patients than other states of India. Dear learners, talking about cities in India, the increase of cancers in Bangalore, Bombay and Madras in 1992 was 80 per lakh people as compared to 289 per 1 lakh in developed countries. About 15 lakh new cases and 3 lakh deaths are estimated annually in the country, with average survival extending to a mere 3 years after diagnosis. Thus, cancer is one of the 10 leading causes of mortality in the country and constitutes 4.1% of daily losses due to NCDs. The leading sites of cancer continue to remain same over the years, with oral, lung, esophagus and stomach cancers among men and breast, oral and cervix cancer among women. Lung cancer is the most common cancer in men in India, accounting for 11.3% of new cancer and 13.7% of cancer deaths. Oral cancer account for 50 to 70% of all cancers in India, compared to 2 to 3% in the US and UK. The second most common among cancers in women is cervical cancer, followed by breast cancer, with 8 standardized incidence and mortality rates of 22 and 12.4%. 1 lakh women per year. Cervical cancer is the second leading cause of cancer deaths among women in India. 25% of all globally deaths due to cervical cancer occur in India. Next is diabetes. Do you know that the number of people with diabetes in India increased from 26 million in 1990 to 65 million in 2016? In 2018-24, the NCD monitoring survey estimated that 9.3% of the Indians had diabetes. The International Diabetes Federation estimated that 9.6% of the Indians had diabetes in 2021, and the projected number to increase to 10.4 in 2030. More than 90% of diabetes cases in India are type 2. Some estimates project that the number of people with diabetes in India will continue to increase, reaching over 124 million by 2045. The prevalence of diabetes in adults aged 20 years or older in India increased from 5.5% in 1990 to 7.7% in 2016. The prevalence in 2016 was the highest in Tamil Nadu and Kerala and Delhi, followed by Punjab, Goa and Karnataka. The age standardized diabetes prevalence and dailies increased in every state, with the percentage increase among the highest in several states in low and lower middle ETL state groups. The most important risk factors for diabetes in India was overweight, to which 36% of the diabetes dailies in 2016 could be attributed. The prevalence of overweight in adults in India increased from 9% in 1990 to 20.4% in 2016. Coming to thyroid, nearly 42 million Indians suffer from thyroid and many remain undiagnosed. Thyroid put many Indians to risk for cardiovascular diseases and infertility issues, osteoporosis, etc. Highest number of cases of thyroid is recorded in Uttar Pradesh, followed by Bihar, Madhya Pradesh, Gujarat, Rajasthan, Maharashtra respectively. The capital city of India, Delhi, lies in sub-Himalayan plains of India. The region is known to have iodine deficiency in soil and in the cultivated vegetables. The Universal Iodization Program introduced the iodized salt in 1983, which was almost 4 decades back. Still, the population is deficient in iodine and develop goiter and other thyroid diseases. According to Union Health and Family Welfare Ministry latest data, Telangana has 5,763 women per lakh suffering from thyroid. Dietary changes with healthy lifestyles can bring changes in the metabolism and functioning of various body organs, which can perhaps help to mitigate the thyroid issues in body. Besides this, meditation and yoga can also help in thyroid patients to a great extent. Coming to polycystic ovary disease or syndrome, Dear learners, it's important to talk about a common hormonal imbalance issue in females in their reproductive age, that is PCOD. The data on the prevalence of PCOS in India are scarce. According to National Health Portal of India, the prevalence rate of PCOS in Maharashtra was noted to be 22.5% in highest among all. Another report from South India, which included adolescents, shows that incidence of 9.13%. However, the diagnostic criteria for PCOS were different in these studies. In India, it is difficult to gather data regarding PCOS or PCOD as females do not discuss it in open and families too consider it as a taboo to discuss or share the information as they get worried about the girl's marriage and infertility issues. According to a survey conducted by OZIVA, a private organization, key findings of nationwide PCOS survey shows that 35% of women have never spoken about their conditions of PCOS to anyone. Almost 15% of women never talk about PCOS to anyone, and more than 4.5% consider talking PCOS a taboo. Almost 48% of the women find it uncomfortable speaking about PCOS with their spouses and have never done so. Most women prefer discussing this with their mothers. According to the report, around 65% of women have been shamed or know someone who has been shamed for having PCOS or related symptoms like facial hair, difficulty losing weight, difficulty conceiving, etc. And more than 60% of men do not know what PCOS is. This is alarming situation. We need to talk to our children in their puberty age and give them professional help whenever it is required. PCOS can be managed by lifestyle changes to some extent. Eating balanced diet, exercising regularly can resolve the problem associated with PCOS or PCOD. Reproductive health problems of both male and female can be addressed by imparting sex education before the puberty age. Next is hypertension. In India, the age-adjusted prevalence of hypertension was 11.3% among the persons aged between 15 and 49 and was 4% percentage points higher among males, that is 13.8%, than among the females, which was 10.9%. Persons in the urban location had a marginally higher prevalence than the person in the rural location. The proportion of population suffering from hypertension varied greatly between the states, with a prevalence of 8.2% in Kerala to 20.3% in Sikkim. Advancing age, obesity, overweight, male sex, socio-economic status and consumption of alcohol were found to be the major predictors of hypertension. So let us now talk about the management or cure of these non-communicable diseases. The World Health Organization adopted a resolution in the year 2000 on the prevention and control of chronic diseases. It is called on its member states to develop national policy framework taking into account healthy public policies as well as fiscal and taxation measures towards healthy and unhealthy goods and services. The combination of 4 healthy lifestyle factors, maintaining a healthy weight, exercising regularly, following diet and not smoking, seems to be associated with as much as 80% reduction in the risk of developing the most common and deadly chronic diseases. According to WHO and WebMed report, consuming less than the 1 tablespoon of salt a day and reducing an intake of junk food can help to solve the problem of hypertension and CVD. Consuming more of green leafy vegetables and fruits help to maintain metabolic balance in the body. Moreover, home cooked food with less sugar, salt and oil can also help to resolve these health issues. 1 hour of exercise, physical like brisk walking, swimming, cycling, aerobics, yoga can also act as a stimulus towards improvement of health and managing lifestyles. According to one of a study, monitoring a person's lifestyle over a long period of time can be helpful for the following purposes. Number one, early identification of the lifestyle. A person is generally at a risk of a lifestyle disease when he or she lives his or her life in certain style. Moreover, initial signs and symptoms of such diseases appear in people with irregular life patterns. By long-term activity monitoring, it would be possible to identify such styles like irregular and unhealthy, and determining the risk of disease before the actual disease appears. Number two is prevention of lifestyle diseases. It is important to identify lifestyle diseases at the very first place. Noticing your regular body functioning and setting a body alarm of something unusual can help to identify the problem. Before that, we should monitor our lifestyles because prevention is better than cure. A person can assess his or her lifestyle and become aware of any irregular patterns through monitoring daily activity and patterns. Management of lifestyle diseases. A person who has a lifestyle disease should make changes to assure a healthy lifestyle. For example, there is no cure for type 2 diabetes, but it can be effectively controlled by maintaining normal blood sugar levels. This can be achieved through weight control by following a nutritious and balanced diet along with regular and stringent exercises. Consumption of healthy diet. A healthy diet rich in fruits, vegetables, whole grains and lean proteins can help prevent lifestyle diseases. According to WHO, an estimated of 19% of all deaths worldwide are attributable to low fruit and vegetable intake. Studies have shown that diet rich in fruits and vegetables, whole grains and lean proteins can reduce the risk of heart disease and diabetes by up to 70%. According to UNICEF, one of the things that can be done to reduce the risk of developing NCD is to eat nutritious diet, ensuring to include enough vegetables and fruits. According to World Cancer Research Fund International, consuming predominantly plant-based diets reduces the risk of developing obesity, diabetes, cardiovascular diseases and some form of cancer. Plant-based diets are high in vegetables and fruits, whole grain pulses, nuts and seeds, and have only modest amounts of meat and dairy. These diets helps to achieve and maintain a healthy weight, reduce blood pressure and are also rich in source of dietary fiber. Another important thing is to regular exercise. Regular exercise can reduce the risk of obesity, heart disease and type 2 diabetes. The World Health Organization recommends that adults should do at least 150 minutes of moderate intensity physical exercise per week. According to WHO, the first indicator of health is physical activity at the community level. The risk of many chronic diseases such as cancer, CVD conditions and diabetes reduce through regular physical exercise. To promote active and healthier societies, WHO launched a program in June 2018 with the title of More Active People for a Healthier World. This program's primary plan is to create more active and healthier societies by providing spaces and places for physical activity. The improved spaces and areas for physical activity will provide more opportunities for every age group to do dance, sport, walking, cycling and play. Dear learners, it's important to avoid tobacco and alcohol for healthy living. Tobacco use is one of the major risk factor for non-communicable diseases like cancer, CVDs and respiratory diseases. According to WHO, tobacco use is the leading cause of prevalent deaths in worldwide, with about 8 million deaths annually. Alcohol is also linked to cancer and liver diseases. It is important for family and school to impact the knowledge of harmful effects of consuming alcohol and smoking in early ages of life. Parents, teachers should not hesitate talking to students on such things. Governments should take initiatives from acts and carry out various campaigns to address the issue of smoking and alcohol. For example, Government of India under the Ministry of Health and Family Welfare has launched the National Tobacco Control Program in 2007-8 in 42 districts of 21 states and union territories of the country in order to facilitate the effective implementation of tobacco control law, to bring about greater awareness about the harmful effects of tobacco, as well as fulfill the obligation under the WHO FCTC on tobacco. This is Framework Convention on Tobacco Control. Managing stress has become very important to manage lifestyle disease. Chronic stress can lead to health problems like high blood pressure, heart disease and depression. Learning stress management techniques like mindfulness and meditation can help manage stress and reduce the risk of lifestyle diseases. By managing stress, individuals are more likely to adopt and maintain healthy behaviors such as regular exercise, proper nutrition and adequate sleep, which can lower the risk of NCDs. It can help reduce stress hormones, boost the immune function and improve overall health, lower blood pressure, reduce heart rate and improve overall cardiovascular health. It is also very essential to take an adequate sleep. Sleep is essential for good health. Lack of sleep can lead to an increased risk of obesity, diabetes and heart disease. The American Academy of Sleep Medicine recommends that adults should have 7 to 9 hours of sleep per night. Insufficient and mistimed sleep is also a major risk factor for obesity and NCDs such as cardiovascular diseases and type 2 diabetes. Let us now briefly understand some initiatives taken by Government of India to address the challenges of lifestyle diseases. Number 1 is universal health coverage. To address the health inequalities and improve the health outcomes, an architectural correction in public health care system was attempted by Ministry of Health and Family Welfare, Government of India, to strengthen the rural as well as urban infrastructure, human resource capacity and service delivery of public health facilities. India's commitment towards achieving the universal health coverage is clearly reflected through the institutional mechanism and policies directed towards increasing coverage and access to health services. WHO proposed 3 core dimensions of UHS. Number 1, the existing healthcare system and their coverage for the population. Number 2, available range of healthcare services to the population. And number 3, the extent of financial risk protection available to the local population. The National Health Policy 2017 aims to deliver quality health service at affordable cost for achievement of UHS. The National Program on Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, it was launched in October 2010, aimed to institutionalizing response to NCDs and supplementing state efforts through setting up of state level NCD cells and integrating it within the National Health Mission framework. It is a key implementing entity for these activities, with its coverage expected to increase from 100 to all districts across India. The program components include number 1, establishing or strengthening of health infrastructure, number 2, early diagnosis and treatment, number 3, human resource development, number 4, health and promotion, and finally monitoring and surveillance and research. Some of the regulatory initiatives undertaken by Ministry of Health and Family Welfare, Government of India includes Cigarettes and Other Tobacco Products Act 2003, which aimed at prohibition on advertisement and regulation on production, supply and distribution of tobacco products. India was among the first few countries to endorse WHO Framework Convention on Tobacco Control in 2004. The National Tobacco Control Program has been in implementation in 21 states of the country. Number 2 is the Food Safety and Standard Authority of India under Ministry of Health and Family Welfare launched Eat Right India movement in the context of India's increasing burden of NCDs, obesity and micronutrient deficiencies. There are combined efforts that are aligned with Ayushman Bharat, Swachh Bharat Mission and Poshan Abhiyan, Prime Minister's overreaching schemes for holistic nutrition, food safety and standards, prohibition and restriction on sales, regulations 2011 dated 1st August 2011 issued under the Food Safety and Standard Act 2006 by FSSAI laid down that tobacco and nicotine shall not be used as ingredient in any food product, and gutka has been banned. In 2017, FSSAI also proposed a tax and advertisement ban on unhealthy foods. To summarize, non-communicable diseases contribute to around 5.87 million of all the deaths in India and are major cause of NCD deaths in India. These are coronary heart disease, stroke and hypertension, coronary respiratory disease, cancer and diabetes. Cardiovascular diseases contribute to 28% of total deaths in India, followed by stroke, hypertension, chronic respiratory disease, cancer respectively. Obesity and malnutrition both coexist in Indian demography. Lung cancer is the most common cancer in men in India, and cervical and breast cancer is the most common in women. Diabetes, thyroid, polycystic ovary disease are major hormonal imbalance diseases in India which are on rise. Government has launched various policies and programs to combat such diseases, but self-management is the key to such problems. We should monitor and manage the food we eat, exercise daily and take adequate sleep. Stress management shall also help to manage such lifestyle diseases. Thank you.